This is a full body myofascial release program for self-care using the universal massage roller. We're going to walk you through different ways to use the trigger point contoured edges as well as this valley, as well as understand why the density and the softness will help to create balance in some of your joint areas to help restore balance to your nervous system. It's whole body, so we'll start working with the upper body, neck down approach, all the way getting to the bottom towards our calves to end it. Again, with the universal massage roller, it's just going to be a full body self-myofascial release session. We'll start today in a hook line position, lying on your back. We have the universal massage roller sitting at the base of the head, allowing those muscles that support the cranium that tense up to relax and be able to bring the right type of oxygen and nutrient to that area. As we're there, we'll shift our body towards the roller so that it's more on the neck. The head will drop back a little bit, exposing those muscles supporting that neck or supporting that head, and massaging and releasing the tension that builds up. And Tyler can find out if this spot is good or if he wants to go one more. The next spot down his neck, he's a tall guy, so he'll have a longer neck. We'll bring you down to the actual base of the skull. The head can drop back. In this position, I like to look both sides. So look this way, really letting that trigger point edge of that roller dig into both sides of those larger muscles supporting that neck a couple times. And then in a neutral position, go ahead and bring your chin up, pressing in, and then at the same time, bring your chin down to your chest. This one right here will expose that musculature and really force a good compression type massage on the back of the neck, allowing for all the great properties of massage to take place. So while on the neck, try to go through 2 or 3 segments, looking left and then looking right, 2 to 3 times, and stay on the neck for about 60 seconds before transitioning on to the next movement. This is a thoracic spine release using the universal massage roller. And one of the great reasons why we use this roller is that not only can he trigger point those muscles surrounding his spine and use the trigger point knobs on it to tract and pull apart his spine and create space a little bit, but he'll also be able to roll because of the softness, the durometer of it. He won't be so restricted to just vertebrae segment to vertebrae segment. If he wants, he can go ahead and do a little bit longer. So we're going to take it here. He'll interlace his fingers behind his head. We'll have Tyler bring his elbows together. The more you bring your elbows together, the more your back is exposed, the musculature exposed to the roller. And now he can either do 2 things. He can go segment by segment, or he can just roll. And that's the benefit of having this larger roll, is that you are able to utilize it to move. His spine will fit perfectly in that channel and not cause any pain on the spinous process or the vertebrae as he rolls and unlocks all of that adhesion and soreness that's going on in the middle of his spine, his T-spine. He's gonna do this for between 30 seconds and a minute. You might get some popping, and I always call those freebies because you didn't have to go see your chiropractor to get it, but you will just feel the unlocking of that vertebrae sometimes, and so about 30 seconds to a minute is good here. The next part of this total body release using the universal massage roller, after we've released the neck and the T-spine, we're going to move down the chain, down the spine to a sacrum. Now, we're going to allow the sacrum to kind of reset itself. So Tyler has a position directly on either side of his sacrum at the top. And so what we're doing is allowing that sacrum to sit on this soft massage roller and allow the sacrum to balance itself out. So he sits in this hook line position, and your body's gonna move back and forth to try to find balance. This alignment will actually put balance into your system and help the nervous system reset itself by unimpinging maybe a blocked sacrum or something that was going on in there. So this isn't through massage, but it's more through a method where we can float that joint and allow that joint to slowly get itself back into position simply by taking the load off of it and allowing that to happen by itself. So this might take a minute or two to really find that balance. Once you feel like no more changes can be made and you have that reset, then we can go ahead and move on. So after we worked along the line of the spine, now we're gonna work laterally to that spine. And so we're gonna go ahead and unlock the quadratus lumborum using the universal massage roller. So the design allows it to very easily be able to trigger point that area and help release in a very non-dramatic way. So we'll start right here. The quadratus lumborum sits between your hip bone and your rib cage. From there, if you don't feel the pressure, go ahead and start extending. So I'll ask Tyler to bring that arm out and then slowly bring his lower leg out so that it becomes in line or flat with the ground. He'll take some deep breaths in to help relax through here so that that segment can open up over the universal massage roller and allow for some movement to start happening and that eventual release to take place, breaking through anything that's blocking or adhering so that he can have nice rotational mobility in that lateral spine. So from this position, he can kind of roll forward and back a little bit as a way to open up that QL a little bit more. Another thing that he can do is take that bottom leg and bring it up and then back down. So he activates and then resets, which might move that fascia a little bit to relax that area to get even more play in there. He's gonna do this for between 30 and 60 seconds and then go ahead and repeat the procedure on the other side. Now we're gonna move up the body and pick on the rotator cuff, anterior rotator cuff. So we took the universal massage roller, we placed it underneath his rotator cuff here and here. It's nice and long, so his arm fits right in there. And we're gonna ask Tyler to go ahead and do some movements where he brings his hand forward above his head and then slowly back down. And this is a pin and stretch technique where that massage product is holding onto the tissue as he walks up and down. The contoured edges of the universal massage roller are actually what are creating that shearing effect or that opening of the fascia where his arm and the head of his deltoid can just sit comfortably in that contoured valley of the product and allow him to really get some good range of motion in there and some good movement and breakthrough of that fascial system. So really good for healthy shoulders. The next step in this total body release series. We'll work in doing maybe probably 12 to 15 repetitions on the rotator cuff just because it's one of those really overused muscles. And then we'll repeat this on the next side. After we address the rotator cuff, we're gonna immediately address the lat. Again, that lat has that really big tie-in point and is really searching for range of motion. And so we're gonna give it to it. The lat, among other things, is one of the places in the body that really binds up. And so our ability to release that by pulling through this fascial line and allowing our universal massage roller to act as that barrier that just pins that tissue down as we elongate can create that range of motion, can provide that disturbance in the fascia and mix it up to bring in the oxygen and the nutrients to that area to prevent that soreness. Great for performance gains with overhead athletes or anybody looking for more range of motion in that area. So on a sideline position, Tyler is gonna just bury the universal massage roller in his armpit. It's really easy because it has a channel. That channel fits right in that lat. And then what I'm gonna ask Tyler to do is he can then begin to extend his body, really focusing on bringing that pinky, because that's that fascial line under there, up as he lifts, big stretch through, and then bring it right back down to a relaxed position. Again, go ahead and drive and reach through. And if you don't feel it exactly sideline, you can lean back a little bit to work that opposite side or the back part of that lat and still do your reaches and then you relax. Or you can go a little bit forward, belly side down. But it seems in this position, being perpendicular or a little bit back, you get a better feel right in that big lat belly, that attachment point to that lat where you're able to feel that big stretch. Again, try to keep your face nice and relaxed. Don't grimace and don't guard for best results. 30 to 60 seconds on each side is probably good. Left and then right. The next movement in this total body series is the tricep. So we went from rotator cuff to lat, and now we're diving right into the tricep. Your ability to open up and unlock the tricep becomes important for throwing movements or anytime you want to extend that arm, breaking through any sort of adhesions here in the elbow or as it tracks down back to the lat or the shoulder become very important. And so we are going to channel that tricep in right in the valley of the universal massage roller and do a piston technique where we piston up and then drive through that tricep. Again, trying to hit all heads of that tricep. So with a palm up position, we can go ahead and drive through and reach those fingers forward here, extending that elbow. Good. On our way back up as we're driving down. Again, Tyler can put as much pressure as he wants into this product. That's why self-care is so cool, because you can put the amount of pressure that you can tolerate into it. And then he can do two things. He can go thumb side, so if he wants to really extend over, he can go, bring it back that way. A little more of this external play on the outer side of the tricep, or he can go internal and hit a little bit more of the internal side of that tricep, even sort of encompassing the medial side of that bicep. Again, total arm is good, but this is a great way to hit the underside of that arm or your tricep for great extension and flexion. We're going to do this for about 30 to 60 seconds, and then we will do the other arm. Okay, continuing on this total body release, we're now going to go to the forearm. A lot of people have asked about a forearm release, and we finally now have a product that is really geared for this. So putting the wrist inside this valley or this channel of the universal massage roller, Tyler can now press down with as much pressure as he can possibly tolerate, extending at the fingers, bringing it all the way to the elbow, and he starts in a palm up position. But because your forearm is flexors and extensors, you can go ahead and start moving the hand in different positions to really affect the different movements that are going on so that you can hit different muscles. And the contoured edges of this universal massage roller are what are actually wrapping around and releasing that tissue. So now in this palm down position, he'll just start driving that forward. And a technique you can do here is as he brings it back with pressure, he can go ahead and flex here and extend fingers up as he drives through, or he can do the opposite of that, so different articulations of the hand to go ahead and provide pressure on that forearm. Palm up, palm down position. Again, really attack this forearm, beating up the radial and the ulnar side. Every time that we throw a ball or move and we have this rotational movement, we get affected. There's a lot of Tommy John surgeries that are happening in baseball, tennis elbow, you name it. That's that powerful acceleration and rotation, and then the deceleration of that rotation that is causing all sorts of injuries. And so your ability to create space, make that area malleable, reduce soreness by massage and opening up and creating good myofascial release on all of those adhered parts, it becomes very important and a way to negate those symptoms from happening. So we do this for about 30 to 60 seconds per arm and then go ahead and switch sides. So the next part of this total body release series is the lower body. What I like about the universal massage roller is that it is a roller as much as it is a trigger point device. It's really a hybrid tool. So Tyler is going to treat this next exercise like he would using a flat foam roller. He's going to put the pointed part or the larger part, the front part of his quadricep right in that channel, and he's going to move forward 2 inches, and then he's going to go 1 inch back. Move forward 2 inches, and then 1 inch back. Using the technique that you would use on a foam roller, but this has a little bit more bite to it because of the contoured edges that will bite those muscles that he's on. The other nice thing about this is that it is a little bit softer, so you can put a lot more body weight on those contoured edges and really get the benefits of rolling out that quad. Now again, he's right directly on it, but he could also work the lateral side of that quad by changing positions or turning his toe in a little bit, just like that. And the same thing with the adductor side or the inside part of your quad. He could turn his foot out and stay on that other track there. So go ahead and roll your quad for about 30 to 60 seconds. Just make sure you get all the way from hip down to your knee. That may take a little bit of time. Once you're there, going two inches up, 1 inch back, go ahead and switch legs and continue. The next exercise we're going to look at here in this total body release series with the universal massage roller is one of the most important. It's for the hamstring. So many times in athletics, people come up injured because they pulled their hamstring. So many times individuals have bad backs because their hamstring is too tight. So the universal massage roller is an awesome tool to help alleviate that soreness by providing circulation and hydration to those tissues, at the same time elongating those tissues and breaking through those adhesions and those things that make that hamstring tight and stuck. So we'll go ahead and start here at the knee, and we're going to move an inch at a time. I'm sorry, 2 inches up and 1 inch back. So it's this rolling movement. 2 inches through, 1 inch back. And to create more pressure, Tyler has gone ahead and lifted his hips off the ground. If he wanted even more pressure, he could go ahead and cross this leg over the other one. What happens here is he starts putting a little bit more stress on his shoulders, but again, it's more pressure on the hamstring. So you decide what's comfortable for you. Go ahead and drop that foot down again. Good. So we'll walk this all the way to our glutes or all the way to our hips. We'll make sure that we hit the really high part of that hamstring, because the contoured edges of the universal massage roller on those glutes or right butting up to those glutes is really impactful and can really start digging into and shearing those, or targeting that fascia that separates that hamstring from those glute muscles. And so he's gonna wanna do this for about 60 seconds, but just like quad, there's 3 different areas. So here's the area that he's on now, or the zone that he's on now. He can evert or turn his foot and hit a more lateral zone. And a little bit more difficult, but we can go ahead and do this too. He can point his toe inward and moderately attack the inside of that hamstring. It's just an awkward position because of how your femur rotates, but any little bit helps. Try to hit all 3 of those zones, working yourself from knee up to hip. Again, this will take you maybe a little bit more than the 60-second spot, but that's okay because it's great to take your time with your hamstrings. Make sure that you're really rolling them out, compressing them so that they can fully hydrate and have really good contraction potential afterward. Continuing on with the lower body of this full body trigger release with the universal massage roller is we're on to calf now. And so the calf is fairly easy because it's a smaller muscle group. The calf fits right in the channel or the valley of the universal massage roller. And we're just gonna have Tyler move up and down. Again, we'll follow the 2 inches code that we've been using. 2 inches up, 2 inches back, 2 inches up, 1 inch back. Really just starting to feel the tissue in there unlock and release. Again, if Tyler wanted to make this, put more pressure on it, he could do what he's doing now by lifting up his pelvis, or he can go ahead and cross that leg over. Now, the one cool feature about the universal massage roller, because the sides are essentially where the trigger point are, go ahead and bring that foot back, is now he can go ahead and point that foot out just like he did with his hamstring and his quad to hit the lateral aspect of that calf and into the Achilles tendon. Follow the same routine, 2 up, 1 back. And then he can go ahead and point his foot inside, evert that foot a little bit, good. And then he can track 2 up, 1 back as well. Back and forth on that roller. until you bring it all the way down to your heel and into that Achilles tendon. On the Achilles tendon at the very end, I really like to make sure that we're enforcing that. So go ahead and put that right on top of this guy there, bearing down, and then just go back and forth a little bit, really trying to break through those adhesions. Again, that Achilles tendon, one of the biggest tendons in your body, really overused, always wants to adhere. Because we use it so much, we lay down a lot of fascia on that all the time. And if we lay down too much fascia, it takes away the range of motion. And so by mobilizing it in this way, by massaging it, it'll start breaking through some of that fascia, allow for a clean range of motion so we can have high performance and optimal performance with that Achilles, leading to good sprinting, running, walking, etc. We'll do this for about 30 seconds to a minute. Back of knee all the way down to ankle, and then switch legs and continue. The last exercise of this total body trigger release program using the universal massage roller is going to be the anterior tibialis, or the shin muscle. The shin muscle really starts activating every time we go into dorsiflexion. So anytime he tries to bring that toe up, it activates that muscle there. So it's used quite often. If you're heel walking or heel running or sprinting, we're always going to activate that dorsiflex position. And so that muscle is going to become pretty overused. And so it's really important that we create good range of motion, take away the soreness by adding blood, nutrient, oxygen to that tissue site, and to create good, healthy tissue in that area. So in a 90-degree angle, I always kind of form these 90-degree angles all over with the foot, with the quad, this leg here. We're able to put the universal massage roller right in track here. And one thing Tyler can do is he can lean his body forward and actually press down with his hand, or press down to create more force. Again, the cool thing about self-care using these portable products is that you're able to pull them out, do this anywhere, and he doesn't have to worry about a coach like me bearing down on him where he goes, oh, that's too much. He's able to create his own pressure, so that's one of the great things. So what he can do here, besides put the pressure on, is now he can start moving and articulating his foot forward and back and creating movement patterns so that the muscle will move and the ball or the universal massage roller will just pin that tissue, and he moves it around it. It's kind of a pin and stretch technique as he goes from the ankle all the way through his knee. And then he can move the ball around as well. He can bring it behind him or in front a little bit to create a little bit more aggressive edging, so he can shear and really create that range of motion on that shin muscle. So he'll do this for probably 30 to 60 seconds, and then we'll be able to go on to and do the other leg. That was a total body trigger point release session using the universal massage roller. We started at the neck, took it through the entire body, all the way down to the ankle. You can do this program 10 minutes a day, 3 to 5 days a week, and be in really great shape, looking at really healthy tissues.